back, just around the hips, and we do the opposite actions. That is stretch our back, and make sure that you don't have dizziness of your head, to prevent yourself from fall down on the floor. Okay, make sure safety, and do these actions for 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. So after 10, you can take a small rest. Anytime when you sit for 1 hour or 40 minutes, you can stand up and do 10 times of the opposite actions to help your back to recover from the bent position. Okay. Also, we can also do another very easy exercise that is called what? I check. Called 不是不行。Abdominal breathing. It is called abdominal breathing. It is a very easy and convenient way to enhance the muscles deep inside our body. Do you know the 腹横肌? Abdominal breath. It is a good way to enhance the strength of the transverse abdominal muscles. Transverse abdominal muscles. That is the muscles just inside our abdominal. That is called transverse abdominal muscles. And it is very easy also. We take a deep breath and our abdominals just take a deep breath to our abdominal, and then take out the breath with your mouth. Take in the breath with your nose and take out the breath with your mouth, and make the breath out as long as possible. You can see me take in with your nose and take out the breath with your mouth. Like this, with your mouth, how to say that? 撅嘴. Pouting, yes, pouting your mouth, pout your mouth and take out the breath, and as long as possible. You can feel your abdomen. You can feel your abdomen just like a balloon. Maybe when you take in the breath, your abdomen is like a balloon, become bigger. And when you take out your breath, and the balloon becomes smaller and smaller. That is a good way to enhance the muscle, the transverse abdominal muscle. And that will be, if the transverse abdominal muscle becomes stronger, then the low back pain will become less. Understand? You understand what I mean? Because the transverse abdominal muscle is a 腹横肌是腰部。Because the transverse abdominal muscle is the natural waistband of the waist. Understand? It's just like a band, a waistband. If the band becomes stronger, so that will protect your back, right? Will protect your vertebrae of your lumbar vertebra will protect your lumbars. So you can do this abdominal breath 10 times for 1 time. 10 times. Take in and take out 10 times. And you can do this 3 times a day. That will strengthen your abdominal muscles, transverse abdominal muscles. So these 2 ways to protect your low back and to protect your lumbar spine. Okay, I think it's time to continue our class now. So you still can see my screen, right?
Yes, 老师。
Okay, let's continue our class. Okay, but only 16 people in this room. I think that there's one student still. I don't know which one student is not in this room. Maybe you need to the monitor to need to remind the student, because I can only no, I'm sorry, I made a mistake. You have only 15 students, right? So everyone is in this room. Okay, let's continue. Just now we studied the definition of physical therapy. We also know that it is the physical therapy is consisted with 3 parts. That is functional training, physical modality therapy, and manual therapy. So let's see what another definition, the definition of physiotherapy. I need yeah. I can't find the pens that I cannot use the pen. Forget it. Another definition, it is physiotherapy is a specialized medical related discipline to study how to improve human health. How to improve human health.
是看不到你的屏幕。
哦，看不到 PPT。现在看得到吗？
看到了。
好的。So physiotherapy is a specialized medical related discipline. It is a discipline to study how to improve human health, prevent and treat disease, and restore, improve, or reconstruct physical function through these 3 ways, right? Physical factor, functional training, manual therapy, and physical factor therapy, such as sound, light, electricity, magnetic, heat, cold water, and force. So this discipline is to study how to use these different ways to deal with the disease of our human body. And we can see these 3 sentences. It is the basic component of rehabilitation therapy. Rehabilitation therapy has a lot of different ways to deal with disease. Physical therapy is only one of the ways to deal with disease. We also have OT. OT, that is occupational disease. The OT, the picture shows you OT. The first picture shows you, this picture shows you the occupational therapist, that is OT therapist, teaching the patient to use the hands, do some exercise to training the function of the hand and the upper limbs. And the second one, the OT therapist is teaching the patient how to take on and take off the clothes. So it is what an OT can do. OT is also a rehabilitation therapy. And also we have speech therapy, speech therapist. Speech therapy is to teach the patient to how to speak and how to communicate, right? Also, we have swollen therapy. Swollen therapy, maybe some patient after stroke, they cannot swallow food and cannot swallow water. Each time when he drinks some water, he will cough. That means he has some problem with the swollen functions. So we need ST therapist. ST therapist also means swollen and speech therapist to deal with the swollen dysfunction. And also we have a rehabilitation nurse. Rehabilitation nurse is to teach the patient and the family members how to keep a right position after disease. Because such as after stroke, we need the patient put their arms and put their legs in a right position. Otherwise, maybe the patient will lie on the bed for 1 month, and after 1 month, maybe the tone of the muscles will become very high, and it is very difficult to move the arms or move the legs. And also, we also need the rehabilitation nurse to deal with the urinate problems, and also teach the patient and the family members to turn over on the bed, in case the formation of the pressure sore. Do you know pressure sore? In case the formation of the pressure sore. A pressure sore means when the patient lie on the bed for a very long time, maybe after 1 day or after 4 hours, there is a sore on the back, and especially those have bones. So we need a rehabilitation nurse to teach them do the daily life care. Also, physiotherapy is an important part of rehabilitation medicine. Rehabilitation medicine to deal with the disabilities, impairment, and some other dysfunctions of our body. So physiotherapy is a part of the rehabilitation medicine. And it is also one of the skills that therapists, especially physical therapists and occupational therapists, that must master in China. Not only in China, I think in the whole world, PT is one of the most important skills that therapists must master. Because they need these different ways. They need to master these different ways to deal with patients, right? So you know the physical therapy. Rehabilitation medicine. include 3 parts. Rehabilitation medicine includes 3 parts. I need, yes. Rehabilitation medicine includes 3 parts. One part is rehabilitation assessment. Second part is rehabilitation therapy. And the third part is rehabilitation prevention. In fact, so the rehabilitation medicine includes 3 parts. The first one is prevention, the second one is assessment, and the third one is therapy. So we know physical therapy is one important part of rehabilitation medicine. Maybe you feel confused. There's no physical therapy in the rehabilitation medicine. In fact, in this part, rehabilitation therapy, right? Rehabilitation therapy and physical therapy is a basic component of rehabilitation therapy. So it is in this part, rehabilitation therapy. And also rehabilitation therapy is a basic component of rehabilitation medicine. So we can say that physical therapy is also an important part of rehabilitation medicine. And it is also a skills that the therapist must master. This picture shows you the content of the physiotherapy. The first one, the therapist is to help the patient to move her hip joint, right? This one, the therapist is help the patient to, the second one is help the patient to do some muscle strength training. And this is the electricity stimulation, and this is massage. Also, it is called manual therapy and modality therapy. And this too is movement therapy. And this is occupational therapy. Occupational therapy is also a important component of rehabilitation therapy, but it is deal with some, especially to the upper limb functions and the hand functions. So the occupational therapy is also called 作业治疗 in Chinese, and this called 物理治疗 in Chinese. This called 作业治疗. That means 作业治疗 occupational therapy is especially deal with the upper limb, especially the hands function. You can see from this picture that the therapist is teaching the patient to training the upper limb strength and teach the patient how to eat by herself and do some daily exercise. We can see that this patient has no arms, right? And he is using a machine instead of the 4 arms. So he is training his new arm. Also receive the occupational therapy to training the upper limb functions. And this one is teaching the patient to take on the clothes. And this one teach the patient training. Maybe this patient like doing some painting some plants. Maybe this patient is like painting some plants. So occupational therapy has a very special characteristic, that is to combine with the hobby of a patient and using and make use of the hobby of the patient to and put it in the daily training. Maybe this patient like plant some like to grow some flowers. So the occupational therapist can put this kind of training in the daily training. And this one is, maybe it is a driver. Maybe it is a driver. So in the hospital, we will offer some kinds of situations for the patient to do the same thing, and this can help them when they go back to the society. They can do the same thing after they go home or go back to the society. So this is what occupational therapists do. It is different with the physical therapy. And this table shows you the whole content of the physiotherapy. It includes 3 parts. The first one is movement, and the second, modality therapy and the manual therapy. First, we are going to see the movement therapy. There are different ways, 1, 2, 3, 4, 5, 6, 7, maybe, and also there are some other ways, some other therapies in the movement therapy, but the base movement therapy we are in this table. The first one is muscle strength enhancement training. I think some of you may go to the gym to practice, to practice, right? Go to the gym and want to make your muscles strong. So it is as for the patients in the hospital, they also need muscle strength enhanced training. And there are a lot of different ways to deal with a lot of different ways to enhance the strength. And later, some other teacher will give you class and teach you how to use different ways to enhance our muscle strength. The second one is joint range of motion training. You know, arthritis or maybe a fracture after fixation of the fracture, right? The patient cannot move the joint smoothly, and so they need joint range motion training. Also, there are different ways, techniques can be used. We can use joint range of motion training. That means the PT therapist just help the patient to do different directions, all the direction that the joint can do. The therapist will help the patient do the all the directions. And the second is joint loosening surgery. Oh no, maybe this is wrong. We can call it manipulation. 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 I'll show you a video. I'll show you a video how to do a manipulation. Take the shoulder as an example. Can you see my screen? Can you see the video?
Yes, I'm sure.
Yes, sure.
This is a manipulation of the shoulder joint. The shoulder can move, right? The shoulder joint can move in six directions. So the therapist should do all the directions manipulation for the shoulder. Up and down. You can see the therapist is offering manipulation therapy to this small joint, and this is the active movement of the joint. but manipulation can do some other directions, some other movement of the joint. This is called manipulation. And also mechanic technique. Just now I've teach you one this technique to help with your low back, right? The third one is aerobic training. Aerobic training is especially used to those who have heart disease or the lung disease, right? People have heart or lung disease can use this training to enhance the function of the heart and the lung, and also some other disease, some athletes or some after some surgeries, they want to go back to their daily training. So we also need to teach them how to do the aerobic training. And for the older people, we also need to tell them to do some climbing or do some walking and swimming and etc. to enhance the lung and heart functions. Balance and coordination training. Just now I've told you that after stroke, people cannot just lie on the bed and they cannot sit straight, right? Or they just can sit with their back lying on the chair, right? They cannot sit straight or they cannot stand. Maybe they need someone to help them to stand, and they cannot stand by themselves. So this is balance dysfunctions. So we need to offer balance and coordination training. There are the ways that so these are the ways that the PT therapist can choose to training the balance training. Also neurodevelopment treatment. Just now I've tell you after stroke, right? The patient's brain have some problem. So the connection with the brain and our legs, our arms, and our speech, the connection broke down, right? So we need to use neurodevelopment treatment to deal with this dysfunction of the brain. So we can use Bobas, Brownstone, or PNF or root therapy to deal with these kinds of patients. Motor relearning program, MRP, motor relearning program. And some other new techniques. This two part is new techniques that nowadays we use a lot in the rehabilitation department. You can see in this video, the people is working, right? But he is not working by himself, but with a machine help. So it is called rehabilitation robotics. With the help of the rehabilitation robotics, he can walk, and we can help him to reconnect the brain and the working model quickly. Physical modality therapy. You can see there are 1, 2, 3, 4, 5, 6, 7, 8 different modalities we can make use, right? Electrotherapy, phototherapy. The phototherapy include infrared therapy, blue and violet therapy, and ultraviolet therapy, laser therapy. I think you must be very familiar with ultraviolet therapy, right? Do you know ultraviolet therapy? As a medicine student and as a student, maybe you are very familiar with this, because in the treatment room and almost in every department of the hospital, we have the ultraviolet light to 消毒. Do you know? We need the ultraviolet light to disinfection and sterilization, right? To disinfect, to do the disinfection and sterilization. So it is also way treatment in our department. For example, you have a sore throat, so you and the inflammation of your sore. We can use ultraviolet therapy to deal with the inflammation. The blue and violet light therapy. Yeah. Okay. So these are the different ways of modality therapy. Manual therapy. We have Western manual therapy and traditional manual treatment. The Western manual treatment includes massage. Massage means do some soft massage on the tissues, very 浅层 very shallow, maybe on the skin or maybe on the tissues under the skin, the muscles. Deal with the muscle, the skin, and the tissues under the skin. And the joint mobilization. Just now I've showed you different videos of joint mobilization, right? It is also the manual therapy. And manipulation. Manipulation means we deal with. I'll show you pictures later, okay? So the PT purpose, the purpose of physiotherapy is to improve human health, right? There's no doubt that all the treatment is to improve human health and to prevention and treatment of the disease. If we do some aerobic training, right? We do some aerobic training and do some aerobic training, we can prevent the disease of our heart and our lung, right? And if we do the mechanic training of to help our neck and help our back, we can prevent low back pain and neck pain, right? So it is also prevention and treatment of the disease. And to restore, improve, or reconstruct somatic function. Of course, all of this treatment is to do this. And we need to know another definition. It is called physiotherapist. That means a person who administers physical therapy. And it is also a medical related professionals, but it is different from doctors and the nurse because it is medical related professionals, but it is different from doctors and nurses. The PT cannot prescribe, and he just offer treatment to the patients according to the prescription from the doctor. Exercise therapy. There are different techniques we can use to offer this therapy, such as we can use active movement. In fact, as for a healthy person, we usually use active movement to enhance our muscle strength and to keep the range of our joint, right? Active movement, there's a definition, the movement produced by the muscle contraction. So we, in fact, for example, we need to grab my phone, right? When I need to grab my phone, as a healthy person, I just stretch my arms and grab it. So it is a active contraction of my muscle, and I finish the action. But for many patients, maybe after stroke, they cannot move their hands, so they cannot do the active movement. Voluntary movement. That means this is called voluntary movement, right? The video in these video 2 and video 3 shows voluntary movement, and also it is a resisted movement. This one, if a person need to lie on the bed for a very long time, we usually tell the patient to do the what we call we will tell the patient to do the ankle joint flexion and extension movement. The ankle joint do the flexion and extension movement to prevent DVT. Do you know DVT? Deep thrombosis in the venous, right? That means this is a venous. If a DVT formation, maybe that is this is a DVT, do you know? So after the DVT is a silent killer of our body. So if a patient lie on the bed for a long time, the circulation of the blood cannot go back to our heart, right? The circulation will stay in our lower back, in our lower limbs. The blood just on this part in our lower limbs, so they cannot go back to our heart. That will cause a DVT, called a DVT, deep venous thrombosis. And if the thrombosis fall and circulate to the heart, that will cause what? Cause the lung thrombosis, and that will very dangerous. So we will usually tell the patient to lie on the bed for a long time to do the ankle joint flexion and extension movement. That is a voluntary movement, and this too shows you resisted movement. Also, we have assisted movement. Part of the action is done by the active contraction of the muscles, and part by external forces. External forces, there are different ways to offer external forces, such as we can use a device, and we can also use suspension exercise, and also we can use the healthy side. For example, a patient after stroke, he has problem with the left side, but the right side is good, right? So we can use the right hand together, and we help the affected side to do the actions. So this is the healthy side helps the affected side. Also, we can use the help of the therapist. There are different methods, instrument practice, and we can see some pictures and the videos. We can see that these two videos shows you instrument practice. We use a 体操棒. We use a 体操棒. We use a wand. This is called a wand. A wand. This is a wand to do the with the help of a wand and with the help of the healthy side of our upper limb to do the actions of the shoulder. You can see that, right? Maybe something wrong with this shoulder. So we need the wand. We use the wand and the healthy side to do the instrument practice to help the affected shoulder to recover. This is wand, and this is using a wheel practice. Also, we use a wheel to help practice the range, the shoulder range. And also this is a suspension exercise. So it is called assisted movement. The last one is passive movement. The muscles don't contract during the movement, and the movement is completely by external forces. For example, after stroke, the strength of the muscle is only zero. The muscle strength is zero, and the patient cannot move the upper limbs and the lower limbs at all. So we need to do some passive movement for the patient. The first one is joint motion range movement. Second one is joint mobilization, and third one is continuous passive activity. This picture also shows you can see video 1 and video 2 shows you the therapist, the PT therapist, offer joint motion range movement training to the patient, to the shoulder and to the upper limb joint. We can see that every joint have a different directions movement. When the PT therapist offer this passive movement, he need to offer all directions of the joint. This one is joint mobilization, and just now we have seen the videos, right? And this one is called continuous passive activity that will not depend on not depend on a machine. And this is mechanical therapy. Just now we have practiced. This picture shows you the techniques enhancing muscle strength. The definition of this is according to the principle of overload. Improve or enhance muscle strength through the active contraction of the muscles. So if you want to enhance the muscle, we need active contraction of the muscle. If just the PT therapist help you to move your arm or help you move your joint, that will have nothing to do with your muscle strength. So there are different methods. According to the way of muscle contraction, it can be divided to isometric exercise and isotonic exercise. And according to where the resistance is applied, it can be decided into non-resistant exercise and resistance exercise. At the meantime, resistant exercise include isotonic resistance exercise and isometric resistance exercise and isokinetic resistance exercise. So maybe it is very complex, right? A lot of different ways to enhance the muscle strength. Let's see this picture. This picture shows you strength enhanced practice, and this is called there are two ways of muscle contraction. The first one is isometric contraction. This is isometric contraction. We hold we hold something in our hand, and the joint don't move. Muscle contraction, but does not shorten. That means the joint just stay the way, and the joint don't move. So it is called isometric contraction. These two picture shows you concentric contraction, and this one is called concentric contraction. This one is eccentric contraction. So this ways to help enhance the muscle strength. But some students may confuse that. What about if the patient's muscle is only 0 or just 1 or 2 level? These people don't need to do the muscle strength training. Of course, if the patient's muscle strength is very low, maybe 0 to 2, we still need to do some hand-assisted exercise to help the muscle to contract. We need some techniques to stimulate the muscle to contract by himself, but this will be procedure by professional PT therapist. If the muscle strength reach level 2, we can offer assisted exercise. The assist can be can be offered by the PT therapist. It can also be helped by the suspension, right? And if the muscle strength is bigger than level 3, level 3 means the patient can move his body and against the gravity of the earth. if the muscle strength reach level 3, that means the patient's arms or the patient's legs can anti the gravity of the earth. He can lift his arms and he can lift his legs. So if the patient reach level 3, he can do some active exercise by himself. And if the muscle strength is bigger than level 3 or level 4, he can do some resistance exercise. Here is the table for you, and you must remember this table. This table is very important. That tells you different level strength, different muscle strengths can choose different therapists. We can see these people. He can doing this exercise. That means his muscle strength must be bigger than 4, right? Stretching is another way is another part of the movement therapy. Stretching means treatment for elongated contracture or shortened soft tissue. It is different from traction. Traction can have the function of pulling the soft tissue, but it mainly acts on the joint. So traction is different from stretching. I'll show you the videos. Stretching and traction. Stretching. First, we are going to see the stretching method.
五只鸡侧身，俯卧位或侧卧位，将患者患侧膝关节被动屈曲。
Stretching of
保持一段时间后，放下。
This is the stretching of the quadriceps femoris. And we need to keep the stretching for a while and then put down the legs. This is stretching. And traction. Yeah, where is traction? Yeah, traction is here. Traction is for the neck traction and for lumbar spine traction. This is neck traction. If you have a neck pain or the neck disease, we can use traction. And this is lumbar spine traction. So traction is different from stretching. Stretching only deal with the soft tissue, but traction not only deal with soft tissue, but also deal with the joints. So you need to know the difference between traction and stretching. We can see this picture. There are different stretching methods. Self-stretching, right? The first one is self-stretching, and manual stretching. And this one shows the mechanical stretching. We can regulate the angles of the machine and keep stretch for a while. This is neurodevelopment treatment. You just need to know there are 2 different techniques we can use as for the stroke people and for the children that have brain disease. VooV technique, Brown-Strong technique, and Rude and the KNF technique. There are different techniques to deal with the brain disease. And the motor relearning program, means the recovery training of motor function after CNS injuries as a process of relearning or retraining. So it is also deal with the central nervous system injuries, but it is different from the VooV or Brown-Strong techniques. It emphasizes practice again and again. Emphasize again and again. And the practice must be targeted, must be specialized for the patient. The more exercise, the more effective and functional reorganization. So it is called relearning program, motor relearning program. Another one is called CIMT, constraint induced movement therapy. And this is a new technique nowadays used or not. That means maybe we have something, we have some disease of our left part, so we don't use the healthy part of our body and just use the affected part to help the upper limb recover, to return the functions of the upper limb. It is suitable for the training of the upper limb function after brain injury, also the brain injury. So it's CIMT and CIMT MRP for the brain injury. And this is techniques to enhance cardiopulmonary functions, includes relaxation exercise and endurance exercise. Relaxation exercise such as swimming, walking, and Tai Chi, and health massage, etc. And endurance exercise includes medical walking, cycling, swimming. They are suitable for the patients who have cardiovascular and respiratory disease, mental stress, and the elderly, and those in weak health. Physical modality therapy. Yeah, there are 10 different physical modality therapies. The electricity, right? The first one is electricity. The second one is phototherapy, and we can see the blue light, right? It is blue light, and it is for a new baby. We call it blue and violet light therapy. It is for the new baby. I think you must have learned there's a disease very common in the new baby. It is called 胆红素. The hyperbilirubinemia, right? So we need this light phototherapy to the new baby to help the baby lower down the bilirubinemia. And this is ultrasound therapy. This is magnetotherapy. This magnetotherapy can be used for the fractures. After fracture, and we can use this magnetotherapy to promote the growth of the bone. And this is called compression therapy. Compression therapy to help the circulation of the blood and to prevent DVT. Manual therapy. Manual therapy, Western manual therapy and traditional manual therapy. Both of them have the joint mobilization and manipulations. So we can see in this video, it is a mobilization of the knee joint, right? And this is massage, and this is called manipulation, massage, manipulation, and joint mobilization. The effects on the human body, physical therapy effects on the human body. We can see the exercise therapy. First of all is the exercise therapy. There are 6 parts. 6 parts. It can maintain and improve the function of motor organs, and it's very easy to understand. You just read this part by yourself, the therapeutic effects of exercise therapy. And this is the main therapeutic effect of the physical modality. So you can see there are a lot of fun effects of the physical modality. The first one, anti-inflammation. Just now I've given you an example, right? Rehabilitation, that is for the pain, right? and the antibacterial effect, such as the ultraviolet therapy, right? And the sedation and the hypnosis, such as magnetic therapy, and stimulate nerve and muscles, the electrotherapy, relieve spasm, and soften the scars, the ultrasound therapy. Dissipate adhesion, also the ultrasound therapy. Accelerate wound healing and accelerate bones gap formation, that is the magnetotherapy. And this one is